It's time for our weekly visit with Dr. Zorba Paster, and we'll be taking your calls coming up in the next segment.
And Zorba joins us this afternoon live from the big island of Hawaii. Hi, Zorba.
Lucky duck.
You're there for a conference?
Of course. I had a choice. Rochester, Minnesota, or Kona, Hawaii. It was a hard choice, but I made it.
And you packed well. Packer hat and the Hawaiian shirt.
I got the shirt, I got the flowers, I got the Green Bay Packer hat. Everyone who sees the hat goes, "I'm so sorry. I know how bad you feel."
Okay, I don't want to ask you this, but how is the weather there?
It's perfect. What else can I say? 80 degrees, wonderful weather, slight breeze, primo.
Wonderful.
Yeah, that's great news. And also, it's pretty good news here in Dane County. COVID-19 cases are on the decline.
Right. Omicron is definitely on the decline. Just sort of how the CDC and Johns Hopkins University thought it would happen. So many people getting infected. But of course, the problem is the death rates are going up. And if you look at the data, you are 60 times more likely to die of Omicron and be hospitalized by Omicron if you are not vaccinated. And it's hard to believe in Dane County that there are still people who are not vaccinated. But the reality is those are the people that really end up in the hospital, end up on the ventilators, and unfortunately often end up either death or seriously ill.
Yeah, we're not out of the woods yet. Our mask
by no means.
Our mask mandate here in Dane County just got extended, and so I don't know, people, we still have to stay strong and maintain all the protocols.
You know, I mean, we go inside, you pull up a mask. I mean, it's been that way. You don't really like doing it, but you put the mask on and you say, "I can do this." And you're doing it for yourself and for the people around you. It's just like years ago, people would light up a cigarette anywhere you went. I mean, no matter where you went in a restaurant, somebody next to you lit up a cigarette. No one would do that now. And the answer is, if you're not getting immunized, you may be affecting and infecting the person next to you. So the answer is, it's our public health, it's our duty to actually get immunized. And that's really important. Now we have very good data. We know how safe they are. They're as safe as measles, mumps, German measles, polio vaccines. And it's important for all of us to ante up and get vaccinated and get boosted.
People have been vaccinated for over a year now, some people, and we're all still here.
Right. That's exactly right. We're all still here waiting to take off our masks. If everyone gets vaccinated, maybe we can do that.
All right. Now it's your turn. Call in if you have a question for Dr. Zorba Paster.
Call now. The number is 608-270-9933. And Zorba will take your calls live from the Big Island when Live at 4 continues. We'll be right back.
We are taking your calls for Dr. Zorba Paster, 608-270-9933. And we're going to start with Jill from Fitchburg. Hi, Jill. What's your question?
Hi. I am a grandma, and I have a 2-year-old grandson, and I'm wondering where they are in the vaccines for them. Are they going to come out Are they coming out this year soon, like in the spring, or are they in a big study that takes more development?
Good question.
Sure. Very good question. Right now, I mean, the studies are going on. The CDC is very careful as it goes through, and the FDA looking at exactly what the side effects are. I don't think we have an exact number. I think what I've heard best is it's going to come out this spring. That's the best news I can find.
Okay. All right. Thank you for calling. Let's go to Bev in Beaver Dam. Hi, Bev. What's your question?
Hi. A week ago, or a little more than a week ago, they came out with a toll-free number to order the COVID test over the phone for people that don't have internet service. Well, I tried calling that number, and at the very end, you have to give an email address in order to complete your request. So it did not go through.
It failed. Sorry to hear about that. I don't have a good answer for that. That's really a good point. I don't even know who you would contact in order to find out. Probably call your local representative and see whether or not they can work on that. Good question. I don't have the answer.
Yeah, I don't know what the point of a toll-free number is if you have to give an email at the end.
Right.
All right, let's go to John in Madison. Hi, John. What's your question?
Hi. I would like to know what is your most optimistic guess and your most pessimistic guess as to when this pandemic will end? Thank you.
My most optimistic guess is that it's going to end sometime this spring or summer, the numbers will be down to the point where we don't mask. Now, the reality is we're probably going to live with COVID just like we live with influenza. It may turn out to be seasonal. We know that influenza kills 20 to 70,000 people a year. I suspect once we get COVID into that range, we're going to live with it and we're going to figure out exactly what we're going to do. Maybe that we mask in the winter, maybe not. But I think over the spring, I think it's going to get less, but it's not going to stop completely.
Do you think there's evidence yet, Zorba, that it's peaking in Dane County, or it's too soon to tell?
Absolutely. Omicron has not been as serious for many, many people. Obviously, we have an increase people in the hospital, but the reality is it's so super infectious that it's actually making a big difference. So I think the peaking is there nationally and in Dane County for sure.
All right, let's go to Andre now in Madison. Hi, what's your question?
Yes. I have a question about, I was vaccinated April, I got COVID in September, and my doctor and the state is saying that, and several other doctors are saying that I don't need a booster, but I'm also wondering why we're not mentioning much about those people who have had natural immunity.
Oh, sure. Well, first of all, you do need a booster. After your second shot, 5 months later, you do need a booster. So if anyone said you don't need a booster, they are wrong. You do need a booster. And the reality is, if you've had COVID and you've had all 3 shots, turns out your antibodies are super high. Now, whether or not that protects you from getting another form of COVID in the future, we don't really know yet. But the answer is everyone needs 3 shots. If somebody told you only needed 2 shots, they're incorrect.
But natural immunity changes with different viruses, right? For example,
100%.
for measles, you have natural immunity
Right.
for your life, but this,
Right.
not necessarily, or we don't know yet.
Well, that's correct, and that's because measles did not end up mutating like coronavirus, and we don't know what the coronavirus is going to be like. So get all 3 shots, your full immunization and your booster for everybody, whether or not they had COVID or not.
All right, let's go to Robert now in Richland Center. Hi, Robert, what's your question?
Yeah, I was wondering when they started giving out informed consent on these vaccines.
Oh, there's been informed consent for more than a decade. Whenever you get a vaccine in our office, we hand you a sheet of paper, you read it, and you make a decision, and that's with all vaccinations. It's probably been 20 or 25 years.
So that's nothing new.
Yep, nothing new.
All right. Well, we are out of time. Thank you for your time. How long are you in Hawaii for?
Forever. I'm going to stay here forever.
I wouldn't blame you.
Well, I think we'll have to join you.
I'm here for a bit more.
All right, Zorba, good to see you.
Enjoy it.
Thank you all for calling in.
Thanks for doing this with us. It was very
You're
generous
welcome.
of you.
You're most welcome.
All right, we'll have a final check of your forecast coming up.